Welcome back to the deep dive. We're getting straight into it today.
We are. We're looking at substance use problems, pulling from some core materials on how to recognize and understand them.
Right. The goal is pretty straightforward. Give you a quick but solid handle on what substance use disorders are, how they show up, and, well, the consequences.
Basically, a rapid rundown, yeah, from the basics of, just identifying an issue all the way to the ripple effects.
Okay, let's start with the basics. Our sources talk about a sort of spectrum, a continuum of use.
That's a good way to put it. It kicks off with intoxication.
Which is just the immediate impact of the substance, like how someone changes right after having it.
Exactly. You see those temporary physical things, maybe slurred speech, unsteady walk, but also psychological shifts, changes in behavior.
Then there's withdrawal. That's different, right?
Yeah, withdrawal happens when someone who's physically dependent on a substance suddenly stops or cuts way back. Their body reacts.
Okay, so where does an actual substance use disorder, an SUD, fit into this picture?
Well, an STD isn't just about using. It's when that pattern of use starts causing real, significant problems or distress in someone's life.
And there are specific signs you look for?
There are. The DSM-5, which is the standard guide, lists 11 criteria. You need to meet at least 2 of those within a 12-month period to be diagnosed.
2 criteria, and it varies in severity.
It does.
There.
2 or 3 criteria met is considered mild. 4 or 5 is moderate. And if someone meets 6 or more, that's severe.
Got it. And these criteria cover a few different areas.
They do. Broadly, things like losing control over use, negative impacts on social life or responsibilities, using risky situations, and then the pharmacological stuff, tolerance and withdrawal.
Can we touch on a couple of those, maybe with some examples like loss of control?
Sure. Think of Ron, who intends to just have a little bit of marijuana but ends up using way more than planned. Or Lisa, maybe planning just 1 drink but ending up having many more. That's loss of control.
Okay. What about trying to stop but not being able to?
That's another one. Inability to cut down. Like Dennis in the Materials, constantly trying to quit smoking but just can't manage it. Or Liz, who knows crack cocaine is harming her but keeps using despite wanting to stop.
And preoccupation. Does that mean just thinking about it all the time?
Pretty much. It becomes central. Like Sandy, who actually steals drugs from her workplace because getting them is such a focus. Or Steven, planning his entire day around when and how he can use cocaine.
Wow. And craving, is that different?
Craving is that intense desire or urge. Jack feels it daily, even after stopping. Jessica feels that strong pull for pain pills. It's a powerful feeling.
And this all leads to problems in real life, obviously, like responsibilities.
Big time. Failure to fulfill major role obligations.
Yeah, that's
Chris dropping out of college because of his cannabis use, or Megan neglecting her kids due to her drinking. It shows how use interferes with life.
That really paints a picture. It's not just about the substance itself.
Not at all. And sometimes the substance use can actually cause other mental health issues, or at least look like them. These are called substance-induced disorders.
So the substance use itself causes, say, depression.
It can. Like Matt, his depression seemed directly linked to his cocaine use and actually went away when he got sober.
But it's not always that clear-cut.
No, definitely not. Take Shannon. When she stopped using substances, her underlying anxiety and depression actually became more obvious. So sometimes abstinence reveals pre-existing conditions. It can be complex.
Let's talk scale. How common are these issues?
Unfortunately, they're very prevalent. Alcohol, tobacco, cannabis are widely used, and misuse is common. Opioids are a huge concern, too.
Yeah, the opioid situation, prescriptions went down a bit.
They did decrease somewhat after 2013, but prescription levels are still high. And worryingly, we've seen a big increase in illicit opioid use, like heroin and especially fentanyl, and overdose deaths have climbed dramatically.
And people often use more than one substance, right?
Yes, polysubstance use is increasingly the norm, which complicates things further.
Okay, so widespread use, potential for SUD. What are the broader consequences? You mentioned ripples earlier.
Huge ripples.
Yeah.
Across basically every area of life. Medically, obviously liver disease, risk from alcohol, lung issues from smoking, emotionally increased anxiety, depression.
Work and school must take a hit.
Absolutely. Like that attorney losing billable hours we read about. Job loss, dropping out of school, it's coming.
And relationships, family.
Definitely. Family conflict is almost a given. Kids worrying about a parent, like the example of the parent smoking. Friendships get lost. Hobbies dropped. Legal problems, arrests, DUIs. Financial strain is huge, too.
So it can range from subtle things people might miss to really life-threatening problems.
Exactly. It's a wide spectrum of consequences.
And the impact on the family unit itself sounds particularly rough.
Oh, it is. Kids might not get their needs met, emotionally or physically. There's the financial burden, the constant stress, fear, anger, that loss of trust. It's incredibly difficult.
And sadly, kids growing up in that environment are more likely to develop issues themselves later on.
That's a tragic reality, yes. There's a clear vulnerability there.
Okay, so wrapping this up. Substance use isn't black and white, it's a continuum.
Right, from intoxication up to a diagnosable SUD, based on specific criteria showing negative life impact.
And those impacts are broad health, work, finances, relationships.
Especially families, they bear a heavy burden.
It really highlights how interconnected everything is. Which leads to a final thought, maybe. If everything is so linked, what's one shift, maybe in understanding or in how we approach it, that could potentially kickstart the biggest positive change for someone caught in this?
That's a powerful question to ponder. What single leverage point could make the most difference?
Definitely something to think about. Thanks for breaking this down with me today.
My pleasure. Important stuff.